For Shamattawa Chief Eric Redhead, this crisis is personal.
The single mother of 4 who passed was actually my only sibling.
He's called a state of emergency as a community mourns 2 young women who died by suicide and an unrelated 7-year-old boy who's in hospital after a serious attempt just days later.
The concerning thing is when we have one, we often see copycats or a domino effect.
Mobile crisis teams are being sent to the remote community, but he's asking for more help from Ottawa, specifically child and adolescent mental health support.
Typical response of the federal government, it's fluff, we're here for you. Until I see boots on the ground, I will not be satisfied.
We'll get them whatever they need as quickly as possible.
The Indigenous Services Minister says 2 mental health therapists are on their way to the community. Ottawa is also looking at longer-term solutions.
What we've realized quite quickly is you can't do good public policy by crisis.
I'm baffled that he would say that. I know when the crisis is over, the conversation tends to stop.
Health experts across Canada are already fighting to have that conversation, launching a national campaign, Code Pink, to draw attention to how the pandemic is fueling the mental health crisis.
Now, the loss of one child is too many. To think of a child as young as 7 attempting suicide is gravely concerning.
This advocate says hospital admissions for attempted suicides have, on average, doubled during the pandemic, and 70% of kids aged 6 to 18 say the pandemic has harmed their mental health.
We need all of our leaders at the table now, putting together an emergency plan to get our kids through the weeks and months ahead of us.
The people of Shamattawa are measuring their crisis in hours and days, trying to stem a flood of despair before it takes any more lives. Karen Pauls, CBC News, Winnipeg.